It is so overwhelming when you sit down in that classroom and go from class to class and you have your first clinical experience and you're just like, whoa, this is going to be hard. I've got a lot of work ahead of me.
What I think was great about the Columbia education is that you spend a lot of time in the classroom learning from a textbook, learning from lectures, getting the foundation that you need, and then you have amazing, amazing clinical placements where you're able to implement those things that you learned in the classroom, see how it plays into practice, and use all those strengths you had from the classroom and able to actually take care of your patients.
Right now we are doing our integration, 8 weeks where we come to the hospital. We work a full-time nurses shift.
So our patients are primarily all kids who have been diagnosed with oncological diseases, mostly leukemia patients, some brain tumor patients, some other solid tumor patients who have not responded to typical therapy and have then required a bone marrow transplant to help with their treatment. Our ages usually range from, we've seen kids as little as 3 weeks and taking care of patients as old as 25. To be a nurse on this unit, you have to love what you do. I think that's the most important thing. It's hard here. You're on your feet the entire time you're here. There is no downtime. These kids are very, very sick and their clinical status can change at any given moment. And so you're always using your nursing skills.
Well, I mean, it's a blessing and a privilege and an honor because for a lot of these families, we're showing up at the most volatile points in their life. And I think that's also important for the students to see.
It was eye-opening. I don't think people realize how hard nurses work and how much they do.
I think when you, like that aha moment, when you see the student gets it or the parent gets it, in terms of like my role with the Columbia School of Nursing, I had the privilege this year of having students who I met in the summer when they did their fundamentals of nursing, and then I had them again for their last rotation in pediatrics.
Every day builds. Every day you get more and more responsibilities as you become more proficient at the previous thing you worked on the day before, something that you learn for the rest of your life. So every day it's something new, and depending on your patient and depending on what comes up, that can always change.
One of the reasons I really love precepting the students, especially from Columbia, is that they push me. They ask really, really great questions. They force me to go back to the literature, really understand why we do things, practice evidence-based medicine. They've been a really great part of our team, and we're always trying to hire, our former students because, they're so impressive.
Well, I've gotten to do a lot of different things. I've seen patients for their pre-surgical consultations, and I've also done post-op evaluations about a month to 6 weeks after patients have been discharged. But mostly I've been working with patients sort of in the perioperative setting.
My current student, Alice, is one of the best students I've had. So it's a pleasure, and that's why I always volunteer to take 2 to 3 students a semester. They're great students.
Tracy, my preceptor, is really great. She's a really great role model. She has a very wide knowledge base, and she's also very skilled at what she does here. And she's also a good example as somebody who advocates for herself as a nurse practitioner to be able to practice to the full scope of her abilities.
I work with a surgeon, Dr. Alan Stewart. We do complex aortic cases. We also do standard bypass surgery. We do valve surgery, but our forte is complex aortic surgery, specifically valve-sparing root surgery.
And she does a lot of different things, which I sort of think is sort of the role of the NP, is sort of fitting into the healthcare system to just be sure that patients are getting the best possible care in all different types of settings. It definitely, she's working in this team setting with a surgeon, and I definitely thought of a nurse practitioner as somebody who's part of the wider healthcare team.
In our practice, we precept a lot of the Columbia nursing students. We precept the ETP students, master students, and also some of the DNP students. And I personally have done a lot of precepting with the master's students, and they're just a great bunch of nurses. They come to the clinic very enthusiastic. I think that their education has really prepared them to function well in the sort of the real clinical setting. They spend about 220 hours in our clinical setting, And I think they grow so much during that period of time, and many of them, when they leave me, are about to graduate. And I think that I feel like very comfortable that they're really prepared to get out there and function in the real world.
Essentially, in collaboration with my attending intensivist, I provide postoperative care to patients who have undergone heart and lung transplantation. And so the students from Columbia University School of Nursing, as a nursing professionals, they're actually very responsible, they're compassionate, and also they're very respectful. And as students, I find them knowledgeable, very eager and motivated to learn. They're very good.
My Columbia education has definitely prepared me. I'm in the adult gerontology program, and they do focus a lot on the primary care aspect of care.
My classes at Columbia, I would say that I can appreciate it now more than I could while I was going through that, because while you're going, you don't realize how much you're learning. It's so much, it's so overwhelming, that you're going and you're doing and you're going and you're doing. And now that I'm here at my integration site and I'm working, the 3 12-hour shifts, and I'm able to apply and recall those things that I learned, I realize how much that I learned at Columbia and how much my professors taught me. And even though I thought while it was happening, how am I ever going to know this, that it actually did work.